Pistons' Zudio, Cade Cunningham, is suffering from a collapsed lung, pneumothorax, as a result of a blow he received to the ribs during this play. Let's understand more. At first, the medical team thought it was just a bruise or back pain, but gradually the full picture became clear. So let's start with, what exactly is a pneumothorax? This is a medical condition in which there is air in the pleural cavity between the chest wall and the lung itself. This air partially separates the lung from the chest wall, presses on it, and prevents it from expanding and contracting freely. Because of this, the lung collapses either partially or completely, depending on the amount of air present. Pneumothorax is usually divided into three main types: primary pneumothorax, which occurs without any underlying disease; secondary pneumothorax, which occurs when there is some underlying illness; and traumatic pneumothorax, which results from some kind of blow, injury, or even a stab wound to the chest that creates a hole there. The symptoms are chest pain and shortness of breath, and often in mild cases the symptoms are barely noticeable, which makes diagnosis difficult. In the end, most diagnoses are made using an X-ray. We look at the size of the affected lung compared to the healthy lung, and by listening to the expansion of the lung. Many times, pneumothorax is initially missed because the symptoms closely resemble back pain or trauma to the area, making it difficult to diagnose. This also fits very well with Cunningham's case, who was initially diagnosed with back spasm, some sort of spasm or contraction of the back muscles, and only later was diagnosed with a collapsed lung. So how did this happen? According to reports, during the play, the Washington player's knee hit him in the ribs, and then it gradually developed into a collapsed lung. Often, when we see a blow like this that isn't too traumatic, and sometimes might not even seem severe enough to justify a collapsed lung, there is some underlying condition that causes it. For example, an anatomical tendency to have small blebs in the pleural cavity. This is called a bleb, and then it only takes one blow, not even a severe one, to cause it to turn into a collapsed lung. According to a study from Denmark, the largest risk group is young, tall, and thin men. There we see an incidence of 12.3 cases per 100,000 people compared to 2.2 cases per 100,000 people among women. This certainly doesn't mean that basketball itself causes pneumothorax, but this population group, tall, thin men, is at higher risk than other populations. In the NBA, for example, over the past 17 years, I found only 4 cases of pneumothorax. The treatment for pneumothorax depends on the size of the injury, the severity, and whether the patient is stable or not. In mild and stable cases, the treatment is usually conservative, meaning monitoring and providing the patient with oxygen. In more severe cases, either aspiration is performed or a drain is used, and in very severe cases where there is persistent air leakage, surgery will be performed. In the case of what we have is a notice that he is under observation and his condition will be reassessed in 2 weeks. And I believe that if he had undergone any procedure, they would have reported it. So what happens after the diagnosis? There is no set or agreed upon timetable for the rehabilitation itself, and it mainly depends on the patient's symptoms and functioning. Still, we do have some reference points. Research on pneumothorax rehabilitation in athletes shows that in cases defined as mild, rehabilitation takes about 4 weeks, and in moderate or more severe cases, it ranges from 8 to 12 weeks. The recommendation for returning to activity is only after we see on an X-ray that the lung is at full size and there are no signs of pain, shortness of breath, or, of course, air leakage. Another important point is that pneumothorax sometimes recurs, especially primary pneumothorax. A large meta-analysis showed a recurrence rate of 32%, and the risk is mainly in the first year. A good example is CJ McCollum, who suffered from pneumothorax both in 2021 and in 2023. In summary, Cunningham is suffering from a pneumothorax, a collapsed lung following a severe chest injury and possibly some underlying genetic predisposition. It's not entirely clear how severe the injury is, and it's possible that he could return in as little as 3 months. But in my estimation, his condition is relatively mild and he will return within 3 to 4 weeks, with the playoffs already starting in less than a month. Good luck.